Hello, Dr. Mason. This is Lauren Obermeyer, an OT student at USI Health. I am here to provide an update on Susan Smith, including a summary of her initial evaluation and progress to date since beginning skilled OT. Susan Smith is a 74-year-old female who was evaluated on 1/20/2022 for a left total knee replacement. She rated her pain as a 10 out of 10 with an emphasis on that left knee. Prior to her surgery, the patient lived with her spouse. She reported needing assistance with ADLs and IADLs. Her past medical history includes type 2 diabetes, a heart attack, a stroke which affected the right side of her body, anemia, and anxiety. The patient has stated that she would like to go home, and the patient's spouse will take Susan home if Susan can complete transfers. And as far as precautions goes, she's 50% weight bearing, left lower extremity, and no treatment if the blood pressure is below 160/90. Some clinical observations on the right side of her body: her shoulder flexion, shoulder extension, shoulder abduction, elbow flexion, elbow extension, wrist flexion, wrist extension, finger thumb movement, and grip strength are all impaired. The left side is all within functional limits. Her gross motor coordination and fine motor coordination, again on the right, is impaired. On the left, it is intact. On the left and right side, the light touch and sharp and dull sensation are both intact. As far as cognition goes, the patient is oriented with a good attention span and is following commands. Her memory is impaired because it was short-term since surgery. Because of that, task initiation, judgment or safety, and problem solving are all impaired due to the memory. Sequencing is intact, body scheme is intact, spatial relations is intact. Her sterogenesis is impaired with the right upper extremity. When evaluated with the psychosocial behaviors, the patient was noted to be pleasant and cooperative with no concerns identified. With self-feeding, the level of function was set up with verbal cues with finger foods this date. For hygiene and grooming, Susan required minimal assistance to brush teeth and to wash face. Bathing required total assistance to wash all body parts. Toileting and toileting transfer was not assessed here. Upper body dressing was noted to be mod assistance, so it required 50% assistance to don shirt. Lower body dressing was total assistance to don pants, briefs, socks, and shoes. Bed transfer and sit to stand were both noted to be total assistance. Her rehab problem list includes decreased ADL performance, cognition with memory, decrease in safety, and decrease in mobility. Her short-term goals: she has met 4 of the 5. The one not met: patient will complete toilet transfer with mod assist. She is currently at a max assist. And then her long-term goals for 2 weeks include patient will complete upper body dressing with standby assistance. It's currently minimal assistance. Patient will complete lower body dressing with minimal assistance. Patient will complete toilet transfer with min assistance. And patient will complete bathing with minimal assistance. Susan is currently receiving therapy 1 time a day for 5 to 7 days a week. So Susan was reevaluated a week later on 1/27/2022. She's a total of 14 days paid by insurance on rehab, and more can be requested. She has participated in 5 therapy sessions since the initial eval, which took place on 1/20/2022. Susan reports her pain level in her left knee is currently a 5 out of 10. Susan's noted memory and safety and judgment impairment during evaluation has cleared with no concerns noted from any staff or Susan's spouse. There have been no concerns in this area during treatment sessions with OT or OTA. Susan reports this date concerns about going home and wants to stay in the inpatient rehab longer. Susan's spouse has not completed family training as of today. No changes in right upper extremity function since initial eval. Per notes from OT or OTA, Susan is performing feeding independently, grooming with setup assist, bathing with max assist, upper body dressing with min assist, lower body dressing with max assist. The PT reports Susan is doing better with transfers, and Susan completed toilet transfer with max assist this date. After these 2 evaluations and reassessments have been done, I would recommend that Susan Smith stays in rehab for another week. First and foremost, she is improving, and we continue to see improvement from the MOD going down to the minimal assist, going down to the standby assist. And that will only continue to get better when given the chance in therapy. The patient is not safe to go home yet, as she has not mastered those transfers and her husband has not completed transfer training yet. And given another week, she will be able to gain more strength and more confidence in her ability to do those transfers. And because she is continuing to improve and she hasn't hit a plateau yet, that is why I recommend her staying in inpatient rehab for another week.